Aspirin is commonly used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It can also help with reducing pain and swelling in conditions like arthritis. Aspirin is known as a salicylate and a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking certain natural substances in your body to reduce pain and swelling. In addition to these uses, your doctor may also direct you to take a low dose of aspirin to prevent blood clots. This can help reduce the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, such as bypass surgery, carotid endarterectomy, or a coronary stent, your doctor may recommend using aspirin in low doses as a blood thinner to prevent blood clots. It's important to consult with your doctor before giving aspirin to a child younger than 12 years old. As always, make sure to follow your doctor's advice on the daily dosage and the best time to take this medication. When taking adult low-dose aspirin EC for self-treatment, it's important to follow the directions on the product package. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with a full glass of water, unless told otherwise. Do not lie down for at least 10 minutes after taking it. If stomach upset occurs, you can take it with food or milk. If you are taking enteric-coated tablets, swallow them whole and do not crush or chew them. The dosage and length of treatment are based on your medical condition and response to treatment. It's important to read the product label for recommendations on the number of tablets you can take in a 24-hour period and how long you may self-treat before seeking medical advice. Do not take more medication or take it for longer than recommended unless directed by your doctor. Use the smallest effective dose. If you are taking this medication as needed, it's best to use it as the first signs of pain occur. Aspirin with a special coating or slow release may take longer to stop pain because it is absorbed more slowly. You should not take this medication for self-treatment of pain for longer than 10 days. You should not use this drug to self-treat a fever that lasts longer than 3 days. If your condition lasts or gets worse, or if you think you may have a serious medical problem, tell your doctor promptly. If you experience upset stomach or heartburn while taking adult low-dose aspirin EC, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of taking this medication outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any of the following: severe or persistent nausea/vomiting, easy bruising/bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes/skin. In rare cases, this medication may cause serious bleeding from the stomach, intestines, or other parts of the body. Seek medical help right away if you experience severe or persistent stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or severe headache. While allergic reactions to this medication are rare, it's important to seek medical attention if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are allergic to aspirin, other pain relievers, or have certain health problems, consult your doctor before using this medication. Daily use of alcohol and tobacco, especially when combined with this product, may increase your risk for stomach bleeding. Before having surgery, tell your doctor about all the products you use. Children and teenagers less than 18 years old should not take aspirin if they have certain illnesses. Older adults may be more sensitive to the side effects of this drug. Aspirin is not recommended for use to treat pain or fever during pregnancy. It may harm an unborn baby and cause problems with normal labor/delivery. Aspirin passes into breast milk, and breastfeeding while using this drug is not recommended. However, low-dose aspirin for heart attack or stroke prevention may be used if directed by your doctor. Consult your doctor before breastfeeding. When taking adult low-dose aspirin EC, it's important to be aware of any potential drug interactions. This can affect how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include mifepristone, acetazolamide, blood thinners like warfarin and heparin, corticosteroids, dichlorphenamide, methotrexate, valproic acid, and herbal medications like ginkgo biloba. Before using this product, consult your doctor if you have recently received certain live vaccines such as varicella vaccine or live flu vaccine. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers known as NSAIDs, nonsteroidal anti-inflammatory drugs such as ibuprofen, ketorolac, naproxen. To prevent an overdose of aspirin, read the labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack/stroke, so consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain/fever. Additionally, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mental/mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If you are taking adult low-dose aspirin EC regularly or at high doses, your doctor may recommend doing some lab tests to check your liver, kidney function, blood count, and salicylate level. It's important to keep all your medical and lab appointments and consult your doctor for more details. There are various types of aspirin products available, some with special coatings and long-acting formulas. It's best to ask your doctor or pharmacist to recommend the most suitable product for you. If your doctor has prescribed you to take adult low-dose aspirin EC regularly, make sure to take it as directed. If you happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, then skip the missed one and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. Remember to always follow your doctor's instructions. It's important to store adult low-dose aspirin EC at room temperature and away from moisture and light. Different brands of this medication may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. Avoid storing it in the bathroom and do not use any aspirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.